Hello, Miss Green. We have doctor's orders for you today. My name is Stephanie Guy. I'll be your nurse today, and I need to go on and verify your name and your date of birth. Very good. Now, those doctor's orders. Your doctor has ordered you to have a Foley catheter inserted. That should help with that urinary retention problem you're having. This is a flexible tube that will go into your urethra, pass into your bladder, and will allow the urine to drain out. Do you have any questions before we get started? All right, let me go gather my supplies. I'll be right back. For this task, we will need a bath blanket. We will need a blanket or a waterproof pad to put underneath you. We're going to need a Foley catheter kit. Look at the proper size on the kit and make sure it fits what the doctor orders. We'll need a leg strap and we'll need a washcloth. All right, Miss Green, let me go on and get your bed up for me. Get your head down. Then I'm going to move you over close to me to where this procedure will move along a lot smoother. All right, I'm going to go on and position your legs up and get you draped. I'm going to put this drape on you in a diamond shape. I have one corner of the drape going to your chin, another corner of the drape going around your leg, one in between your legs, and then another for this other leg. We'll wrap you up nice and warm. Now I like to take my drape, go around the leg to the inner part, and then make a little footy to go over your feet to keep your feet warm while we're doing this. Let's bend this other leg. Go around the leg. Pass under the foot with this nice little cuff. Very good. Now I'm going to go on and pull this up just a little bit, but it still should maintain privacy. Now let me bring my other things in the field and we'll get started with this procedure. Miss Green, I'm going to pull your gown up to where it'll be out of the way and we won't get it stained with this solution that we're going to put on. Now, before we do start, are you allergic to any type of medications? Okay, since you're not, we'll proceed. I'm going to get my Foley kit. I'm going to remove the plastic wrapper. Fold down the top. And place it in a nice open position here at the foot of the bed so we can use that as our wastebasket. Okay, now I'm going to take the kit, remove the tape. Now this is a sterile procedure, so I can't touch anything on the inside of this kit. I'll also need you to be very, very still so that you don't accidentally touch anything inside the kit too. All right. At this point, I'm going to have to go on and remove your covers here from your area. I'm going to fold them back so that I don't inadvertently touch anything. Okay, we're ready to begin the procedure. Okay, now that we have your covers back, I'm going to open this wrapper away from me first, taking care not to touch anything on the inside of the wrapper. Side to side, once again only touching the part of the wrapper that will touch the bed and opening towards me. Now this kit, the gloves are underneath the wrap, so I'm going to take and move the wrap to where my gloves are visible. Go on and get this open for you. Now I'm going to get my gloves out and glove up. Pull your table back so that you are not behind me. I need this in my vision at all times. All right, we're gloved up now in the sterile fashion. And I'll finish with my draping. This drape will go under your buttocks and create a larger sterile field. I have to be careful that my tray does not get more than 1 inch close to the edge of the field. This is a fence-sated drape, and I prefer not to use it. So I'm going to just put it to the side, and we'll use that later on. To clean, I'll put my sterile urine kit to the side. I'll open up my betadine. You can only open this at the little teeth marks where the alligator bit it. Saturate the cotton balls. Open the lubricant. And all you should have left in your kit is your bottle of sterile water to inflate the balloon of the catheter. Okay, I like to turn my tray to where the swabs are closer to the patient. So when I'm cleaning, they'll be readily available. Place the box to the side. Make sure your catheter is in the closed position. And now we're going to check to see that it is patent. Remove this little tab at the end that's covering the port. Open up your water. And inflate the balloon. When you put your syringe in place, be sure to press it securely and twist it just a tight bit so that it won't pop off while you're doing this. Allow the balloon to deflate. And now we're going to remove this protective sheath from the cathalon. Take care when you do that because this is very flexible. I like to kind of twirl it around my hands or my fingers and just toss your waste to the side. Place your catheter in the lubricant and be sure it's in securely. Okay, I'm going to get started with the procedure now. I'm going to have to touch your labia. I'm going to spread the labia and push upward a bit to where I can visualize the urethra. Grasp a betadine swab. Clean the labia majora from top to bottom. Do not pass over your sterile field and discard. Clean the labia majora closer to you, top to bottom. Do not pass over your field. Clean the labia minora, top to bottom. Discard. Clean the labia minora closer to you, top to bottom. Discard. Now we're going to make a swipe right down the center. Discard your forceps also at this time. When you discard your waste, be sure not to place your hand inside the bag. Now we're going to insert the tubing. Okay, let's go on and pick up the catheter. Miss Green, I'm going to start inserting this now. Take a deep breath. I'm going to keep my hand on the tubing while I insert it at all times. Otherwise, the tubing will push out and become contaminated. On a female, I'll insert the tubing until I see urine and then advance the tubing 1 to 2 more inches. After that, I'm going to take my non-dominant hand, which is now not sterile. I'm going to hold the tubing in place so I don't lose placement. Take the other hand, the dominant hand, and let's inflate that catheter. Now I'm going to take my non-dominant hand and hold the port the catheter's inserted in. I'm sorry, the syringe is inserted in. You're going to hold the port and twist and pull on the syringe to remove it. Apply pressure the entire time you're doing this so that your bulb does not deflate. Okay, you're just going to pull back slightly to make sure it's anchored and our catheter is inserted. Okay, I'm going to go on and use this fin-stated drape to clean the site, top to bottom. Fold it to another spot, top to bottom. Remove this betadine and dry the area well. Now that we have your catheter inserted, I'm going to go on and hang the bag. We always want this bag to be hanging below your hips so that there won't be a backflow of urine. This is a little Velcro device. And if we don't have one of these, we could always use tape. Attach it securely to the leg, but not too tight. And let's go in and place it here on the clear part of the tubing. We don't want the yellow catheter to be within this. We want plenty of room on the urinary meatus to where it does not traumatize the client. Take your tubing and hang it to the bed frame. Do not hang it to the side rail. Rule of thumb is the catheter bag is usually placed on the side that the door is not on so that visitors won't have to view the bag when they first enter. If you have extra tubing, simply coil it on the bed. Do not allow it to dangle on the floor. All right, Miss Green, that concludes this procedure. I'm going to cover you back up and get your call light in your reach and your bed back down. And if you need anything else, just let me know.